Cerium Nanoparticles by Lauren Ravo, Lucy Orozco, and Christina Tran. The hypothesis is the use of cerium oxide nanoparticles can potentially be used to stop tooth decay. What are cerium nanoparticles? Nanomaterials have been applied as antibacterial agents by virtue of their unique functioning mechanism different from that of conventional antibiotics. Cerium oxide nanoparticles are important antibacterial agents due to their relatively low toxicity to normal cells and their distinct antibacterial mechanism based on the reversible conversion between two valence states of CE3 and CE4. They are catalysts in many chemical reactions, and through their catalytic activity, they are involved in beneficial redox reactions. They are antioxidants due to their ability to scavenge free radicals. How have cerium nanoparticles been used in biomedicine? Their localized delivery to the eye for treating retinal degeneration. Studies have demonstrated efficiency in neurodegenerative diseases and pathologies of the CNS, improvement of free radical damage leading to increased neuroprotective in vitro studies, which utilize models of both ischemic and stroke and Alzheimer's. Animals in multiple sclerosis and amyotrophic lateral sclerosis studies demonstrated not only a reduction in disease severity, but also improved performance in motor tests. In rodent MS model studies, it was observed that there was a long-lasting antioxidant effect out to 1 month following the final dose.
The advantages in the use of cerium nanoparticles is that they are cost-effective, they have large-scale commercial production, and they have the potential for pharmaceutical applications. Cerium nanoparticles in biofilm bacteria. So several studies have focused on the antimicrobial effects of cerium oxide nanoparticles, but few have focused on their effects on bacteria under initial biofilm formation conditions. Cerium oxide nanoparticles are an attractive option for oral application due to their diverse range of sizes and morphologies attributed to variations in synthetic methodology. Inhibition of biofilm formation takes place in the initial phases of biofilm formation and under non-bactericidal mechanisms. The methods that were used. So hydrolyzed CE4 salts were prepared in strongly acidic media. Researchers planted polystyrene plates with Streptococcus mutans in growth media, then fed the bacteria sugar in the presence of cerium oxide nanoparticle solution. And the same was done with the presence of silver nitrate, a known anti-cavity agent used by dentists. There was a 40% reduction of biofilm growth compared to plates without the nanoparticles, though they weren't able to dislodge existing biofilms. Under similar conditions, silver nitrate showed no effect on biofilm growth. Nanoparticles prevented microbes from sticking to the polystyrene surfaces and the formation of adherent biofilms.
This shows two wells of adherent S mutants. The untreated well on the left displayed significantly more biofilm growth than the treated well on the right. The results. Cerium nanoparticles can potentially inhibit the formation of biofilm, disturb the establishment of biofilm, and eliminate the biofilm. Conclusions of the use of cerium nanoparticles on the formation of biofilm. The size and the way cerium nanoparticles are synthesized matters to determine the way they will take on effect. Streptococcus mutans was not killed. Instead, cerium nanoparticles prevented S mutants from adhering to the tooth. Cerium nanoparticles is less toxic than silver nitrate, and it is faintly colored, so there will be no visibility on teeth. Further research needs to be conducted. Test the efficacy in saliva, the level of toxicity needs further testing to test if it has any activity in the presence of fluoride, and mode of application needs to be determined.